So, this is our third class of the 6th week, and today we will be focusing on botulism toxin. This is a very interesting toxin. It has a wide array of pathological effects, yet this is the same toxin which is used for Botox therapy. I believe some of you are aware about what is Botox therapy, which is being done to look younger, but then how it does so. So, this class we will focus on what botulism toxin is all about. Okay, so getting back to the slide. So, the title of this class will be botulism toxin, and what really botulism toxin is. Botulism mainly affects wild and domesticated animals, begins with the growth of toxigenic Clostridia, which is the microbe, in decaying anaerobic material, followed by release of toxin. So, this is the decomposing organic matter containing Clostridium botulism. This infected material is consumed by botulinum neurotoxin, insensitive invertebrates such as maggots. So, basically these are the maggots which are consuming it, toxic maggots, they are consuming it, which disseminate the bacterium and the toxin to vertebrate. So, and it is reaching the body of vertebrates. The cadavers of intoxicated animals provide an anaerobic environment that enables the bacterium to proliferate. So, you realize that this particular Clostridium is a favorable stuff for anaerobic situation. Okay. Release the toxin. The deposition of insect eggs, for example, for flies, leads to the growth of many intoxicated larvae, which are eaten by the birds or fishes, generating self-amplifying cycle. That's why this fish is shown here, that may rapidly involve birds and or fish. There are 5 forms of human botulism. The 2 most common forms are foodborne botulism, which occurs following ingestion of botulinous neurotoxin containing food, typically canned food, and infant botulism, which is caused by ingestion of food contaminated with spores that germinate into neurotoxigenic Clostridia. Clostridia in the GI tract. So, and we will talk in detail about these ones. These are the 2. Okay. So, foodborne botulism, laterogenic botulism, inhalation botulism, and ingestion of spores. And that is one of the reasons why you will see many a times they say kids should not be given honey. This is one of the things which you will hear in the United States. They say don't give them honey, it may contain botulinum toxin spores. So, coming back to the slide, in the infant, bacterium has potential to proliferate owing to the lack of competition from resident microbiota, which tends to be less robust infant. The other 3 forms of human botulism are much rarer and include inhalational botulism owing to inhalation of BONT containing aerosols. So, that means when you talk about these aerosols, this could be a potential bioterrorism agent. Iatrogenic botulism, which is caused by injection of excessive clinical doses of botulinum toxin, and wound botulism, which is almost exclusively associated with drug injection. Following transcytosis across the intestinal epithelium, subsequent entry, this is what is happening out here, transcytosis across intestinal epithelium, spread in general circulation, entry into the peripheral nervous system, which causes flaccid paralysis in botulism. Now, if we look at the case study of botulinum toxin, the key points for us to remember is Clostridium botulinum is a bacterium, first of all, that produces dangerous toxin called botulinum toxin under low oxygen condition. So, this is anaerobic bacteria. So, when we are talking about anaerobic bacteria, so you have to be cautious about places where there is lack of oxygen. they will be more prevalent in situations lack of oxygen. Their survival strategies have managed to survive in lack of oxygen. Botulinum toxins are one of the most lethal substances known. Botulinum toxin block nerve function, can lead to respiratory and muscular paralysis. And I will explain how it does so. Human botulism may refer to foodborne botulism, infant botulism, wound botulism, inhalation botulism, and other type of intoxication. Foodborne botulism caused by consumption of improperly processed food and is a rare but potentially fatal disease if not diagnosed rapidly and treated with antitoxin, which is the reverse of toxin, something like an antibody towards toxin. Homemade, canned, preserved or fermented foodstuff are a common source of foodborne botulism, and preparation requires extra caution. In terms of the overview, foodborne botulism is a serious, potentially fatal disease. However, it is relatively rare. It is an intoxication usually caused by ingestion of potent neurotoxin. The botulism toxin formed in contaminated food. Person-to-person transmission does not occur. Remember, botulism is not transferable from one human to another human. Spores produced by bacteria Clostridium botulinum are heat resistant. Remember this, exist widely in the environment, and in the absence of oxygen they germinate, grow and then excrete the toxin. There are 7 distinct forms of botulinum toxin, type A to G. 4 of these, A, B, E and rarely F, causes human botulism. Type C, D and E causes illness to other mammals like birds and fishes. Okay. Botulinum toxin are ingested through improperly processed food in which bacteria or the spores survive. They grow and produce toxin in anaerobic condition. Mind it, it is in anaerobic condition they do so. Though mainly a foodborne intoxication, human botulism can also caused by intestinal infection with Clostridium botulinum in infants, wound infection and by inhalation. Foodborne botulinum toxin are neurotoxic, therefore affect the nervous system. Foodborne botulism is characterized by descending flaccid paralysis that can cause respiratory failure. Early symptoms include marked fatigue, weakness and vertigo, usually followed by blurred vision, dry mouth and difficulty in swallowing and speaking. Vomiting, diarrhea, constipation, abdominal swelling may also occur. The disease can progress to weakness in the neck and arm, and after which the respiratory muscle and muscles of the lower body are affected. There are no fever and no loss of consciousness. Remember, this does not exhibit any kind of fever. Botulinum toxin is something very different. So most of the time we talk about high fever and all these things. In botulinum toxin, there won't be any. The symptoms are not caused by the bacteria itself, remember it, but the toxin produced by the bacteria, and that toxin production happens, as in the previous slide I was telling you, in the absence of oxygen they germinate, grow and then excrete toxin. So it means there is a possibility that you will see them in your body where there is lesser oxygen. Their infection site will be places where there are less oxygen. Symptoms usually appear within 12 to 36 hours, within a minimum or maximum range of 4 hours to 8 days. After exposure, incidence of botulism is low, but mortality rate is high if prompt diagnosis and appropriate immediate treatment, early administration of antitoxin and intensive respiratory care are not given. The disease can be fatal in 5 to 10% of cases. Now, in terms of foodborne botulism, is an anaerobic bacterium, as I mentioned, meaning it can only grow in the absence of oxygen. Foodborne botulism occurs when Clostridium botulinum grows and produces toxins in food prior to consumption, and it produces spores. They exist widely in the environment, including soil, river, and seawater. The growth of bacteria and formation of toxin occur in products with low oxygen content and certain combination of storage temperature and preservative parameters. So you have to be careful. There are preservatives which promote the growth of these kind of toxins. This happens most often in lightly preserved food and inadequately processed home canned or home bottled foods. Clostridium botulinum will not grow in acidic condition. So that means you won't find them in the acidic part of your GI tract, pH less than 4.6. Therefore, the toxin will not be formed in acidic foods. However, a low pH will not degrade any preformed toxin. Remember, so low pH can't degrade the toxin, but the bacteria will not grow at low pH. Combination of low storage temperature and salt content and pH are also used to prevent the growth of bacteria and the formation of the toxin. The botulinum toxin has been found in variety of food, including low acid preservative vegetable such as green beans, spinach, mushroom and beets, fish including canned tuna, fermented and salted and smoked fish, and meat products such as ham and sausages. The food implicated differ between countries and reflects local eating habits. Occasionally, commercially prepared foods are involved. So, why this is important is that, so you see the range where the infection can happen, the amount of infection and the zone of infection could be extremely large. Though spores of Clostridium botulinum are heat resistant, the toxin produced by bacteria growing out of spores under anaerobic condition is destroyed by boiling. For example, at internal temperature greater than 85 degrees centigrade for 5 minutes or longer. Therefore, ready to eat food in low oxygen packaging are more frequently involved in cases of foodborne botulism. Food samples associated with suspect cases must be obtained immediately and stored in properly sealed containers and sent to laboratories in order to identify the cause and prevent further cases. Now, in terms of infant botulism occurs mostly in infants under 6 months of age, because this is the age when within your body the amount of microbe growth which can counter Clostridium botulinum is less, because you are not exposed to a lot of food. You are mostly dependent on mother's milk or infant formula. Different from foodborne botulism, it caused by ingestion of preformed toxins in food. It occurs when infant ingests Clostridium botulinum spores, which germinate into bacteria that colonizes in the gut and releases toxin. In most adult and children older than about 6 months, this would not happen because natural defense in intestine that develop over time prevent germination of the bacteria. So, our intestine is equipped over a period of time to develop zones or develop abilities to defend itself against Clostridium botulinum. But in the infants or anyone below 6 months of age, such things does not occur. Clostridium botulinum in infants include constipation, loss of appetite, weakness, and altered cry, and a striking loss of head control. Although there are several possible sources of infection for infant botulism, spore contaminated honey, this is what I was trying to tell you, spore contaminated honey has been associated with a number of cases. Parents and caregivers are therefore warned not to feed honey to the infants before the age of 1 year, because multiple cases it has been seen the honey contains spores of botulinum toxin. So, most of the Western world request the parents and the caregivers not to feed a kid with honey. Wound botulism, the third form of botulism we talk about. Wound botulism is a rare, occurs when the spores get into an open wound and are able to reproduce in an anaerobic environment. The symptoms are similar to the foodborne botulism but may take 2 weeks to appear. This form of disease has been associated with substance abuse, particularly when injecting black tar heroin. So, with drug addiction, this kind of things have been observed earlier. Those who take those injections of heroin and other drugs, this kind of wound botulism has been observed. Now coming to one of the rarest form of botulism, which is the inhalation botulism. Inhalation botulism is rare and does not occur naturally. For example, it is associated with accidental or intentional events such as bioterrorism, as I mentioned earlier, which results in release of the toxins in aerosols. Inhalation botulism exhibits similar clinical footprints of foodborne botulism. The median lethal dose for human has been estimated to be 2 nanogram. So, just realize how potent it is of botulinum toxin per kilogram of body weight. So, that means your body weight is 60 kg. So, it means you need 120 nanogram, which is approximately 3 times greater than the foodborne cases. Okay. Following inhalation of the toxin, symptoms become visible within 1 to 3 days with longer onset time, lower level of intoxication. Symptoms proceed in a similar manner to ingestion of botulinum toxin and culminate in muscular paralysis and respiratory failure. If exposure to the toxin is via aerosol inhalation is suspected, additional exposure to the patient and other must be prevented. The patient clothing must be removed and stored in plastic bags until it can be washed thoroughly with soap water, and patient should shower and be decontaminated immediately. Other type of intoxication in terms of botulinum toxin are waterborne botulism could theoretically result from the ingestion of preformed toxins. However, as common water treatment processes such as boiling, disinfection with 0.1% hypochlorite bleach solution destroys the toxin, and the risk is considered low. Botulism of undermined origin usually involves adult cases where no food or wound source can be identified. These cases are comparable to infant botulism and may occur when the normal gut flora has been altered as a result of surgical procedure or antibiotic therapy. Adverse effects of the pure toxin have been reported as a result of the medical or cosmetic use in patient, and that what we'll be talking about, the Botox therapy. So, if you realize botulinum toxin is a very interesting toxin which bacteria itself is not affecting it till it produces the toxin. Now, the challenge is that toxin production requires an anaerobic environment and a certain kind of pH. So, these kind of microbes are challenge for detection in multiple ways, because if you grow a antitoxin will be successful. Say for example, now if I go back and so these vegetative cells of say Clostridia, they are not going to show any effect till they develop this toxin. But this toxin production will only happen in the absence of oxygen and at certain temperature and pH. Now, you realize that if you have a detection for vegetative cells, that won't be very helpful for you. But what we have developed is, we have developed an antitoxin, but antitoxin will only work when the vegetative cell is producing the toxin. So, these are the kind of challenges what you come across when you are developing assays or you are developing methods, technologies for detection of botulinum toxin. Because what we do is, we detect the toxin, we do not detect the source. Source is the Clostridium botulinum till it produces a neurotoxin. Now, talking about this neurotoxin, as I was mentioning earlier, that this has some very interesting feature about how this is being used for the Botox therapy. So far what we have done, we have talked about what is botulinum toxin, how it is generated by the bacteria. Then we talked about how it infects what are the different types of it, and from here we will move on to the next part of the story, which is how it is used in the fashion world. The use of Botox and its neurological aspect. So I'll close in here. In the next class, we'll start with the Botox therapy. Thank you.